Welcome to the Smiles Are Wild channel, brought to you by Pediatric Dental Associates and Orthodontics. My name is Amy Morgan. We will be bringing you fun and educational videos weekly to help you take better care of your child's oral health care needs at home and on the go. Make sure to subscribe and turn on notifications to see all of our new videos. And remember, it doesn't really matter how you take care of your teeth as long as you take care of them from the beginning. We're starting a new series today called Back to Basics. What we kind of want to do is go through some of the things that maybe either new parents don't know about, teachers don't know about, parents who've been doing this for a long time just may need some reminders on that. So our first event that we're going to have today is just going over how to handle dental emergencies. So dental emergencies occur all the time. They can occur at home, in the classroom, on the go, and there are several things that we want you to know as far as being your pediatric dental provider of what you should do for that, okay? I'll get started with that in just a minute. Just if you're just signing on, I see there's a few more people that have signed on. Go ahead and share the video and tag a teacher, and you and the teacher are entered to win a $100 Target gift card. Okay, so for dental emergencies, basically one of the first things that people call us for, the most common thing that people call us for, is a permanent tooth coming in behind a baby tooth. And the reason I'm bringing that up is because I want to discuss what's a true emergency versus what just needs to be looked at. So a permanent tooth coming in behind a baby tooth is technically not considered an emergency. It is very normal. If your child is holding on to that baby tooth just a little longer than necessary, then that permanent tooth is going to go ahead and push through and find its way into their mouth. And so that's something we do want you to notify us of. Normally we'll tell you to keep wiggling on the baby teeth and see if you can get those out. And then we can always look at it on their next exam. So it's not something they have to come in for immediately unless they are having pain with it. If they are having pain and sensitivity, please let us know and we'll be happy to see them. Again, there's a couple of other things we're going to go over, but baby tooth behind a permanent tooth is probably our most common reason we get a phone call. And then next we're going to talk about chipped teeth. So there's 2 or 3 different versions of a chipped tooth. There's your 4-year-old fell down and chipped their little front tooth just a little bit. Most of the time those are fine to wait until the next business day. It's not something that you have to come straight in for. Usually they don't have a lot of pain or sensitivity with that. Sometimes if they are having pain, it's from the actual fall or their mouth actually hitting whatever it may have hit, because to actually chip your tooth, you had to have hit pretty hard because your teeth are one of the hardest surfaces in your body, okay? So their enamel is super, super tough. So if they have hit their mouth and they've chipped their tooth, they have hit their mouth hard. So that gum tissue is going to be inflamed. Their lips are probably going to be swollen. It's definitely something that we want to do a check on to make you feel more comfortable, but it's not something that you have to rush to an emergency room for, okay? I do want to keep repeating that if any time you feel like it's an emergency to you as a parent and you want to take them to the emergency room, please feel comfortable doing that. That is very important for us to stress, that you know your child, you know what's best for them, and we want to make sure that you understand that. Chipped permanent teeth are just a little bit different and similar to a baby tooth. It all depends on how far up the tooth the chip is. So if it's just like they cut at an angle and it's just like 1/4 of the tooth is missing or something like that, not a huge ordeal. We want to see them, but it's not a huge get to the dentist right now type of thing. If they have chipped their tooth more than halfway up and you're starting to, it's bleeding or it's got anything else going on with it, then definitely, that's more of on an emergency side and we want to evaluate that. We do provide an after-hours emergency service. So you just call our main number and it'll walk you through how to get to the emergency on-call system. And then someone will call you back and we'll triage that for you. So we'll say, how far up the tooth is the chip or down the tooth is the chip, kind of what's their pain level. A lot of times if the nerve is not exposed, then some ibuprofen and some ice should suffice for that. If their nerve is exposed, you will know. They pretty much would not be able to let air hit it, so they wouldn't be able to technically talk. It would be very uncomfortable for them. They can talk, but they'll just tell you that it hurts, and the wind when it hits it is super cold, so it causes a lot of sensitivity there. So if you're getting that sensation from it, then that's definitely something that we want you to call the emergency line for. Let's see. Then there's pain and swelling. So the chipped tooth, I would say, is more common. They fall at school, but we want teachers to know, you've got your school nurses. We're happy to work with them to figure out, whether or not that's a true dental emergency. And obviously you're going to call the parent for that. Something else that may come up in the classroom is just overall just pain. Their teeth are hurting. They can't concentrate. They keep talking about, their jaw's hurting or their tooth is hurting. Those are things that we want to definitely have you keep an eye on. And let the mom know that they were complaining of pain. So sometimes what happens is Johnny comes to school that morning. He's had some breakfast. Something was too hot or too cold. It caused some sensitivity. And Johnny will say, "Miss Smith, my tooth hurts." And if it doesn't come up again, no big deal, but I would definitely send a note home with the parents and make sure that they are aware that there was a complaint made. Because the biggest thing is, we hear all the time, Johnny told mom or Johnny told Mrs. Smith, a week ago. Well, now we're in the dentist office and it's gotten worse. So just be aware of that. Make sure that you're notifying parents when their children complain of any kind of dental pain. It could be something that's simple and no big deal, but we want to make sure that the parent is aware of that, especially if it's only happening at school. Especially as a teacher, you spend so much more time with our kids, even sometimes than we do. And I know just from my sister, I don't want you to have the responsibility of having to take care of their tooth or their dental work. We know that's why they're school nurses, but we do want you to be aware that sometimes, you may be told before the parent is told. So make sure to just send a little note home with mom and just say, "Hey, Johnny complained of some tooth pain today during breakfast." You might follow up with his dentist or something like that, or the school nurse can do that as well. I know y'all have enough on your plate, so I completely am not trying to add anything to that, but that's just kind of a suggestion from us as an office, is just to notify mom. Let's see. Then we have swelling. So if you notice that the child has some like the child is complaining of pain, and you're like, "Oh, Johnny, let me just look at that," and you notice swelling on the inside of the gums, that's definitely something you want to send him to the school nurse for. That could be early signs of an infection, and we want to make sure and get them on antibiotics as soon as possible. So again, that's something, if you see that swelling, send them down to the school nurse. School nurse should be able to contact any dental provider in the area to have that looked at. We're happy to take on any kids in that format, so you just let us know. And then the biggest thing is if they were to show up and their cheek is swollen or their eye is swollen, those are definitely signs of dental infection as well. And those are the more severe cases that need to be immediately seen by the school nurse and get direct emergency attention as fast as possible, because we want to try to get those antibiotics in them as soon as possible. Parents get really busy during the school year, and I would hope that there's no, severe, neglect, and we know that happens in our area and things like that. But, we just want to make sure that you're aware of the signs, so that when you're seeing that in your classroom, that you can kind of be that second person for them to say, "Hey, we may need to send you to the dentist," or send a note home with mom, or, but definitely that outside facial swelling, we want them to see the school nurse very quickly. Okay. Let's see. Then the one major thing, and this is kind of the point I was getting to in the beginning, is that there's emergencies, and then they chip their tooth and it's not so big of an emergency. As a parent myself, a chipped tooth, I would be all over it. I'd be at the dentist, be trying to figure out how to fix it. It would just be a big deal for me. So we completely understand. But the one true dental emergency, I need to get to the dental office as soon as possible, is what is known as an avulsed permanent tooth. So avulsed is spelled AVULSED, permanent tooth. That means their permanent tooth has come out of their mouth, completely out. Sometimes if they have braces, it doesn't come all the way out because the wires are still holding it in, but where you can see the root of the adult tooth, that is a true emergency. That is a get them to the dental office as quickly as you can. If you have a dental emergency for an avulsed permanent tooth after hours, we offer a service and we will come in, try to get it back in. There's a couple steps you can take on your own prior to making it to the dentist. This is going to sound very odd, and for some of you may be very hard to stomach, But if that tooth was to come out and you're holding it in your hand, you're going to put it back into place as best you can. It's much better to have a tooth put back in and not be in perfect position than it is to have that tooth out. So the quicker you can get that tooth back into their gum tissue, there's a better prognosis for it to last. It doesn't mean that it's going to work, but there's just a better likelihood that it might, okay? Let's see. Again, chipped. So your major emergencies in order are avulsed permanent tooths come out. They got hit in the mouth during recess with the ball and the permanent tooth has come out. Now I want to make sure you understand that permanent tooth and baby tooth are two different things. Your permanent tooths are going to have permanent teeth, are going to have really long roots on them, and your baby teeth are going to come out like a lot more easily. Okay, they're not going to have much root on them. You will know pretty much if they're a permanent tooth. If they're around 9-10 years old and they've lost a front tooth, it's most likely permanent. If they're 4, it's not permanent, obviously. So you just kind of have to make that decision. We're happy to kind of triage that over the phone with you. Our office hours in both locations are Fayetteville is usually 7 a.m. to 7 p.m. Bentonville is normally 8 to 5 p.m. Right now we're in our summer hours, but normally 8 to 5 p.m. The phones turn over at 5 p.m. So as of 5 p.m., your phone call would be an emergency triage. And you just select the buttons. I can't remember if it's 1 or 2 for an emergency. You'll leave a voicemail and then someone will call you back. When that person calls you back, they're going to triage. They're going to ask you a bunch of questions. How much is the pain? How did the fall happen? Different things like that. Then they're going to contact the dentist on call, get kind of what we need to do. It's very similar to calling your pediatrician and getting the nurse on the phone and then contacting the doctor and calling you back. So it's that same process. We offer that 24/7. So even if our lines you can't get through and you get a voicemail, you should still be able to hit a button to get to the emergency, okay? If you, for some reason, I do want to just say this disclaimer, get the emergency line on accident, we have a non-emergency line where you can leave messages about canceling appointments, rescheduling appointments, things like that. So if your child's sick and you can't make your appointment, make sure you're leaving that message on the non-emergency line, not on the emergency line. So back to teachers in the classroom. So one of the major things we also want to talk about too with emergencies is also just overall teaching oral health care. I know for a lot of young kids, we do a lot of classroom skits. So I'm going to talk a little bit about that. We do a program called the Cavity Bug. It's where 2 girls will come to your office. One kind of acts like the dental office worker and the other girl ends up at some point becoming the cavity bug. It's a very cute skit. We talk about good snacks versus bad snacks. We talk about how to brush and floss, and we go through a dental visit. Some kids, even in kindergarten, 1st grade, have not made it to the dental office, and some of that is fear from the child. Some of it's fear from the parent of how they're going to act, and I'll go over that in just a little bit. But, we want them to learn that it's not a scary place, that it's a fun place to be, and that taking care of your teeth is very, very important. We have a saying that it doesn't really matter how you take care of your teeth as long as you take care of them from the beginning. So we're going to have in our series about back to basics, we're going to go over that as well. Kind of when you should bring your child to their first dental appointment and how to maintain that oral health care throughout the time that they're in the home with you. I am going to go ahead and open it up for questions, and then I'll talk a little bit more about how to schedule the cavity bug. Does anybody have any questions that they want to ask about dental emergencies? As a teacher, do you have anything else that you would like for me to go over? I'll give them just a few minutes. While we're doing that and waiting on the questions, go ahead and share this video. That way you are entered for a $100 Target gift card. And then you tag a teacher in the comments on the Facebook post for the live, and they're eligible to win a $100 gift card too. And I said earlier it was for your classroom, but if you want to go and buy new clothes for the first day of school, you just go right ahead. All right, Samantha says she's so glad she works in a preschool. None have permanent teeth. Samantha, that's very true. Lots of tagging. Anyway, share the video with your teacher friends. Keep tagging them. I will keep the the contest open until the end of the day today, and I'll probably just do the drawing tomorrow. So share as many times as you possibly can. And if you think of a teacher later on, come back to the post and tag them. And I'll do the drawing for both cards at some point tomorrow or Wednesday, and then we'll get those either mailed out to you or you can pick them up in whichever one of our locations is convenient. I do want to talk about two things as we close up. One is how to schedule the cavity bug skit. So if you're a teacher and you want us to come visit your school, normally it's for preschool age. I would say second grade is probably your top out age that's really going to pay attention and get anything from the program. Then just email me. My email is Amy, AMY, at smilesarwild.com. So that's our website. So it's spelled SMILESAREWILD.com. So it's Amy at smilesarwild.com. Just shoot me over an email. Let me know if you'd like for us to come visit our classroom. I do know the first week of February is usually really booked, and then the entire month of February is super booked because it's Children's Dental Health Month. So if you want a date in February, you need to let me know ASAP. We also usually only do them on Friday mornings. So I try to book as many as I can. So we try to work around your schedule, but just know that most of them are going to be on Friday mornings. Again, my email is amy at smilesarwild.com, and that is to schedule the cavity bug skit for your classroom. And again, that's usually applicable for ages preschool to about second grade. And then I want to talk a little bit about our locations, just so you know. We have one in Bentonville and one in Fayetteville. I've already talked a little bit about our hours. We're open in Fayetteville from 7 to 7, and then we're open in Bentonville normally 8 to 5. Right now we're in our summer hours until school starts, so that's 7 to 3. Our contact phone number is area code 479-582-0600. You can also find us on our website at www.smilesarwild.com. And then we also have fun on social media. So if you're watching us right now, obviously you have Facebook, so go ahead and like our page. And then also we give away a lot of stuff on Instagram as well, and our Instagram is smilesarwild. Again, if you have any questions, I've included my email several times, and I will include it in the comments. Just reach out to me, let me know. And if we can help you out with any kind of dental emergency, or you have a question about something that may not seem right, just let us know. We're here to help, pretty much 24/7. I appreciate you all watching today. Thank you.